irritable bowel syndrome can be many things. We always like to rule out things like cancer, inflammatory bowel disease, celiac disease, gallbladder disease, and then we start thinking about functional GI disorders. And IBS is a functional disorder. So this can mean bloating, abdominal pain, belching, diarrhea, constipation. It can mean one of them, it can mean all of them. What that means is we can't find a structural cause for symptoms, but patients are very symptomatic and it can cause a lot of anxiety and fear for patients. So once we rule out all of these structural problems that can happen, then we start dealing with probable IBS. We don't entirely know. There is a link with trauma and anxiety and depression. There are people that are just wired to carry more stress in their gut. Sometimes we have no idea why someone has IBS, but it can affect anyone. It's often like if people come to us with alternating diarrhea and constipation, or constipation that's been going on their whole life, or diarrhea that's been going on their whole life, or chronic bloating that doesn't get better with diet changes, those are often IBS. Well, we can treat with many things. We often work with our GI psychologists at our Anschutz campus and dietitians to help with dietary modifications. There are medications that help. Sometimes therapy will help dealing with that. All of these can help improve symptoms. And the great thing about IBS is it's a very safe diagnosis. So we just need to work on improving symptoms and quality of life. So IBS often waxes and wanes. People feel good for a while and then symptoms can come back, and stress can be a huge trigger for symptoms. So it really depends on what patients have tried in the past, what's worked for them in the past. Sometimes we need to trial different medications. Sometimes we need to revisit with a GI psychologist or work on therapy again. Sometimes as stressful situations come and go, patient symptoms will get better. And so I always like patients to revisit us if symptoms come back or symptoms get worse. And sometimes it's time to explore, make sure that nothing else is going on in addition to that. IBS is very safe. Again, I think it's always important to see us to make sure that there's nothing serious going on. And as bad as people feel with IBS, we can help them feel better.